So we're just going to talk through outcome measures and just give you some tasks to go through as we go through it. So what is an outcome measure? An outcome measure is a test or a scale that's administered and interpreted by physical therapists that have been shown to measure accurately a particular attribute of interest to patients and therapists. So there's different outcome measures depending on what you're looking for, whether you're an MSK physio, whether or not you're looking at gait, at balance, at proprioception, at strength. So why do we use them? So we use them to, it's a core standard of physiotherapy practice because we need to prove what we're doing is making a difference. It aids prognosis. It allows us to be able to set goals. So if we find that there is a weakness with a patient or we find that there is a difficulty with balance, then that gives us something to be able to work on. It allows us to give information to a patient. So to be able to say that you've scored 5 out of 9 on this test and we need you to be able to score more. We're evaluating the quality of what we're inputting into the patient. We're able to give information to the commissioners of physiotherapy, so thinking about the local care directives and who ultimately funds our physiotherapy departments. We need to prove that the service that we're providing is appropriate. We can use outcome measures within research to show that a particular input works or to show that a particular input doesn't work. And we can use it for service evaluation and development. So being able to improve the provision that we're providing for our patients, or maybe just even work smarter within our departments. So there's certain attributes of an outcome measure. It needs to be or should be standardised with explicit instructions for administering and scoring. And it should be reliable, valid and responsive to the clinical change. So looking at the 4 target pictures below, so the top left one shows that the when you're taking shots at a target, it's unreliable and invalid. When taking shots at this target, it's unreliable, so you're not hitting the centre of the target, but you're generally hitting the target itself. If it's reliable but not valid, then you're reliably hitting the same wrong spot. And if it's reliable and valid, then you're hitting the same target zone in the middle. So what characteristics are important when we're considering a measurement tool? So is it a good outcome measure that's going to provide evidence of change? And does it provide evidence of change in one or more patients' characteristics over time? So does it develop over time? And does it allow us to use it and develop with the patient? Does it measure what we want it to measure? So does it measure, for example, strength change over time? And does it is it valid enough and is it reliable enough to measure strength change over time, depending on how much input we put into that patient? It must be clinically relatable to the patient themselves. So is it an outcome measure that is important to the patient? There's no use as trying to improve strength if in fact the patient wants to improve function. Does it measure small but clinically important differences? And is it able to quantify those? And is it reliable? Does it give us consistent scores, whereby if it was used by the same person at different times, would it give the same score? And if it was used by different therapists, would it give the same score? So there's different types of outcome measures. There's self-reported measures, whereby the patient themselves report. So that's normally in the form of like a questionnaire. A performance-based measure. So it requires the patient to be able to perform a set of tasks or movements that is reported by the therapist or potentially by the patient themselves, so they're able to do something yes or no. An observer-reported measure is normally completed by the parent or caregiver or somebody who regularly spends time with the patient. Really useful within paediatric setting or within the learning difficulty setting. And then there's the clinical clinician reported measure, and that's normally completed by a healthcare professional. So thinking about the psychometric properties of an outcome measure. So we're thinking about validity interrelator reliability, intra-relator reliability, responsiveness, any ceiling effects, any floor effects, and any clinically important differences. So what is validity? So validity is how accurately the test measures exactly what it's supposed to measure. And reliability is will it give the same answer each time? It's really important that you know the difference between validity and reliability. So it might be worth just making a note now of the difference between the two. Inter means between clinicians. So two different clinicians being able to apply the outcome measure. And intra means the same clinician applying the outcome measure. Responsiveness, so is it adaptive to change? And how responsive is it to capture changes if there is a change? Ceiling effect, is the test too easy and does everyone score really highly? And the floor effect is if the test is too hard and everybody scores really low. MCID is minimal clinically important difference, and that's the amount of change that is relevant from the patient's perspective. So is the patient able to recognise that there has been a change? So not all outcome measures are created equally. So validity, does it measure what it says it measures? Reliability, does the measure give the same result if taken by two people or by the same person twice? And then again, just looking at those targets. So target A, poor validity but good reliability. It's not hitting the centre, but actually it's hitting together, so pretty good reliability, pretty reliable, but it's not hitting where we want it to hit. So poor validity, it's not hitting the target and they're not together, they're not reliable. Good validity, right in the centre where we want it to hit and where we want it to measure, and good reliability, they're all hitting the same spot. So for this task, what I want you to do is have a think about which one, when, for what, and for who. So using this link here, have a look at when it be posted. It doesn't matter which case study, using the link 2, and then using link 1, just have a think about what outcome measures are. So what am I aiming to measure? Have the properties of the tool been measured in a population similar to the one that you're using within your case study? Is the outcome measure reliable? Is the outcome measure valid? And is the outcome measure responsive to change? And are there any therapist or client considerations for your setting or for your patient that you want to be able to achieve or be able to incorporate? So what I want you to do is just have a quick pause here and have a go at using outcome measures for one of the case studies listed under here. So this gives a really nice infographic in relation to different outcomes at different time points and when they might be appropriate. So thinking about somebody that has moderate to advanced osteoarthritis, on the left-hand side, pre-op, you can have a look at some of the outcome measures. So there's things like the pain visual analog scale, there's things like the stair climb test, there's the 6-minute walk test and the timed up and go. Thinking about somebody 3 to 5 day hospital stay, you might be looking at timed up and go or the VAS. Somebody in an outpatient or home setting, thinking about the equipment you have available to you or equipment you don't have available to you, what can you use within the outpatient or home setting? And then thinking about 1 year post-op and onwards, again having a look at when these would be appropriate. So it might be worth here just having a look up some of these outcome measures, just so you have some in your toolbox ready to use clinically. So what do physios measure within MSK? So what are we looking at? We're looking at sensation, we're looking at quality and range of movement, mobility, pain, balance, muscle activity, quality of life, sometimes cognition, and mostly activities of daily living and function for the patient. So within MSK, there's a few different outcome measures that are used generally day to day within outpatient settings here. You could have a go at doing the 30-second sit to stand test. You could have a go at using the Baton score, which is a measure of hypermobility. You could use the BESS score and have a go at that one. Each one will link you to the different outcome measures if you want to click on them. The Start Back tool is one that was done by Keele University, and that is really good for measuring how you would expect somebody to respond to rehabilitation of their back. So just take a second to have a look through the outcome measures that are listed, and then go back through to the Blackboard site and have a go at some of the post tasks.